So hi, my name is Ashley. I'll be your student nurse today. I'd wash my hands, and then I'm gonna just check your bracelet. And would you mind telling me your name and date of birth?
Charlotte Neidenbach, October 13th, 1997.
Perfect, thank you. And now I would provide privacy, and then I'd explain to the patient what the procedure is. So today we are going to be doing a full head-to-toe assessment on you, Charlotte. So first I'm going to take your blood pressure. And so, sorry about that. This is a puzzle. But that. And first, if you'll just relax your arm on the table, maybe, that'll be easier. Perfect. Sorry. So first, I'm just gonna find your pulse. So first I'm just palpating the systolic pulse, if I can find the right setting. There it goes. Alright, so I felt it disappear on 130, so I'm going to go about 20 millimeters of mercury above that when I do check your blood pressure. So, by that brachial pulse. Alright, your pulse was 122/80, so that is well within normal. So, now we're going to move on to, I'm going to check your eyes real quick.
Okay.
So I'm going to just compare real quick your pupils, figure out the size, so about a 6. And then if you'll just look at me. Alright. Good. Now, Charlotte, if you'll look at the wall behind us real quick. Now look at my pen. Perfect. So your pupils are equal, round, and reactive to light, and they are accommodate. Next, we're going to move on to the skin assessment. So I'm just going to take a look at your skin and see it's even, and pink, and tan, and so I'm going to check just real quick on the back of my hands. It's warm and dry. I check the legs as well. Once again, warm and dry. No edema noted in her legs, so that's good. Then now I'm going to move on, and I'm going to look at your check your cervical next. So you have your preauricular right there, your postauricular, and then we have your tonsillar, your submandibular, your submental, your occipital's back here, and then we're checking the anterior cervical and then the posterior cervical, your supraclavicular, and then your inferior clavicular. Alright, and all of those were, most of them you couldn't even feel, which is good because she's healthy, and then any of the ones I did feel were movable and they were non-tender. So, that's all within normal range, so that's good. So next, I'm going to just take a listen to your lung sounds. So, we're going to listen here. So you take nice deep breaths for me, okay? I'll listen to you lateral side real quick. Your right. Alright, I'm going to take a listen to your back. Feel lean forward. Alright. So she had bronchial sounds up here towards her neck, and then right in your midline you have bronchovesicular sounds, and then she had clear vesicular sounds in her peripheral lung field with no adventitious sounds heard, which is great to hear. So next we're going to do your cardiovascular system. So I'm going to first start by checking some of your pulses. So I'm going to check your brachial pulse first. And we're going to check on both sides to make sure they're equal. Your brachial pulses are both 2+, which is good. I'm going to check your carotids. And you want to make sure you want to do them one at a time because it's not good if you occlude them both at the same time. They're both strong, which is good. I would check your femoral pulses by checking right down here. I'm not going to do that. I'm going to explain that I was doing that. So I'm going to check behind your knee for your popliteal pulse. That's good. Very good. Next, I'm going to check your post-tibial pulse. That's good. You're both 2+, and then your dorsal pedis. There it is. And 2+, which is good. So we have good strong pulses. I'm going to check around your malleus and then your pretibial, and you have zero pitting edema, which is good. Young and healthy. So next I'm going to listen to your heart sounds. So first I'm going to take a listen to, we first start off with the mitral valve, which is going to be at the second intercostal space on the right sternal border. And then the pulmonic, which is the second intercostal space left sternal border. And then Erb's point, third to fourth intercostal space right left sternal border. And then your tricuspid valve is going to be on the fifth intercostal space left sternal border. And then your mitral valve is going to be the fifth intercostal space left mid-clavicular line. And we'll go back and listen to it with the bell. So S1 and S2 sounds were heard at all sites, and there were no bruits or any extra heart sounds either. So I'm going to listen to your apical pulse really quick. And as long as it's nice and even, I'm only going to listen to it for 30 seconds, so just multiply that by 2. So. Alright, so your apical pulse is 64 beats per minute, but it was nice and even, so all that is good in the normal range. So next we're going to roll on to your abdomen assessment. So I'm actually going to have you lay down on the table for this. So there you go. Make sure that's out of the way. Thank you. So first, do you mind if I pull up this real quick? Thank you, sorry. So I'm going to first listen to your vowel sounds to make sure they're working nicely. Okay, and I'll listen real quick to your aortic with the bell and the renal arteries and then the iliac. So you had active vowel sounds in all 4 quadrants, and then there weren't any bruit. I didn't hear any bruits when I was listening to your arteries. So that's all good. So next I'm going to palpate your abdomen, just feeling for any tenderness or any masses. Alright. I'll check this upper right quadrant, and if you'll just take a big breath in for me real quick. Alright, and then you can feel the very edge of the liver right there, so that's good. And then can't feel the spleen in the upper right quadrant, so that's good. You don't want to be able to feel the spleen. And so the belly is nice and firm and not tender, so no masses. So that's all good. So that is, oh, real quick, I actually have to do, almost forgot one thing. So I'm also going to palpate for in the upper abdomen to see if I can feel the aortic pulse. The aortic pulse is normally about 2.5 centimeters to 4 centimeters wide. So I can feel it. I can't quite feel how wide it is, but that's okay. So we can move on now to the musculoskeletal system. So with this, I'm going to actually have you stand for the most part. So if you'll just look at me, this way we'll I'm just going to have you follow what I'm going to do. So first I'm going to take a look at your neck. I'm going to start with your musculoskeletal system. It is nice and straight, which is good. In alignment, I'm going to feel it real quick, make sure there aren't any tenderness or edema. There isn't. So first we're going to flex down towards toes. And we're going to hyperextend, look up. Very good. We're going to rotate right and left. Checking that range of motion, lateral bending side to side. Very good. So next I'm going to check your spine. So if you just check the spine to make sure that it's in line, which is good. You have a normal curvature. All right, and now can you flex and try and touch your toes? So with here, I'm just checking to see if it's all in order, if there are any weird masses, and there's not, so you can stand back up. All right, and if you can lean back and hyperextend, very good, and you rotate right and left, very good, and lateral bend, so right, kind of reach down to the floor. Very good. Next we're going to do the range of motion for our shoulders. So we're going to flex and extend. And then, okay, we're going to do internal rotation. So put your arms kind of back onto your back. And then bring an external rotation. There you go. Good. And then we're going to abduct away from the body and adduct back to the body. So that's your shoulders. And now next I'm going to have you flex and extend your elbow. And I'm going to just feel, see if there's any crepidation or bursa. There's no pain or tenderness, so that's good. And next we're going to do our hands and our wrists. So both hands out. So we're going to flex and extend, ball hand over the fist. And then if you would put your finger, each finger to your thumb. Very good. Awesome. All right, so next I'm going to check your hips. So I'm just going to feel and make sure her iliac crests are about the same height. Just going to make sure her legs are the same length. So first we're going to flex forward and extend back. You can try that with both legs. So you want to make sure they can both go back. Yeah. All right, and then, okay, so this is the part that takes a little balance, but we're going to internal rotation of the hip and then external rotation. Good. Do both sides. Internal rotation, external rotation. Great. And then we're going to eversion, inversion, or this is technically abducting and adducting. So both sides, abducting, adducting. All right, and now I'm going to have you, well actually this you can, so your knee, you're just going to flex, and I'm going to feel real quick, just to make sure, feeling for any crepitus. That's what I'm feeling for when I feel while you move. I do the same thing in your elbow. No crepitus. Making sure everything, the same kind of divots are there in both feet. So you can sit down so we can do your feet, your ankles and your feet. So I'm going to feel, once again, for any edema, any tenderness, or bursa. Alright, so now you're going to flex your feet, next, dorsiflex. And then I'm going to have you flex your toes, extend your toes, and then if you will, in inversion, put your feet in eversion, put your feet out, and then we're just going to circumduct your ankles. You might feel some crepitation there. I think I can hear it. And that's okay. That's still normal. And then that is all of your musculoskeletal range of motion. You have full range of motion. So that's good. And no crepitus, well, a little bit of crepitus, but no bursa. And so everything within normal range. So next I'm going to assess your cranial nerves. So first I'm going to have you close your eyes. And if you would occlude like one of your nares, like close one of your nostrils. Perfect. And I'm going to put something underneath. Just tell me what you smell.
Coffee.
Mm-hmm. All right, can you do it on the other side? All right.
Coffee.
Yep. Yep, and it was. And next I'm going to check your second cranial nerve. I would check by, normally we'd have like an eye chart, but since I don't have that here, I'm just going to check your peripheral vision while we're doing this. So basically, I'm going to put my hand around you, and when you see my fingers, you tell me, okay?
No.
All right. This side?
No.
Perfect. All right. Next, we're going to check the third, fourth, and sixth cranial nerve. The third is also checked with Perla, but we already did that. And then next we're going to do, so I'm going to have you just follow my finger, and this is eye ocular muscle testing with the 6 cardinal spaces, movements. Perfect. Wonderful. Now we're going to go back and check the fifth one. I'm going to have you clench your jaw, rotate, move around. Perfect. And now for the sensory part of the fifth is, I'm going to have you close your eyes, and whenever you feel something on your face, let me know.
Okay. There. Yeah.
All right. Your fifth cranial nerve is intact. Next we're going to do the seventh cranial nerve, which is your facial nerve. So if you'll smile for me and frown and show your teeth. And puff up your cheeks. Yep. And then I'll also have you close your eyes really tight and raise your eyebrows. Perfect. Beautiful. Next, we're going to check the eighth cranial nerve, which is your acoustic nerve. So we're going to do something called a whisper test. So what I'm going to do is I'm going to come up behind you, and if you would close your ear on this side.
Okay.
Perfect. And I'm just going to whisper a 2-syllable phrase, and you tell me what it is if you can hear it. Clemson.
Clemson.
Perfect. Do the other side. Tigers.
Tigers.
Very good. All right. So now we're on to the ninth and 10th. So for this one, I'm going to have you open your mouth real wide and say ah. You can see her uvula is very midline, falls. I'm not going to check your gag reflex, so that would be associated with your ninth cranial nerve. But then her 10th cranial nerve also has to do with her speech, which we would normally, if you talked with her, you'd realize her speech is nice and smooth, so that is good. Then we're going to move on to the 11th cranial nerve, which is the 11th cranial nerve. I'm going to have you shrug your shoulders. Try and shrug your shoulders against my weight. Perfect. And now can you move your head against my hand? Good. Good. All right, and for the 12th cranial nerve, I'm going to have you stick out your tongue and move it right and left. Yep. Okay, now can you say light,
Light,
tight,
tight,
dynamite?
dynamite.
Perfect. Great. So finally, we're going to just check her deep tendon reflexes, and then we will be done. So first, I'm going to have you, we're going to get you scooch a bit more closer towards the table so you can get your forearm on there. So first we're going to check her brachial. So we're going to make sure her arm is nice and flexed and relaxed as best as possible. And then I'm going to use this guy. Alright, there we go. And then I'm going to have, then we're going to check your, I'm actually going to use this arm to check your tricep. So she's good and relaxed in my hand. Good. So she's doing it right behind the elbow. There it goes, a little bit. Alright, so that was good. So there's your tricep reflex. Next I'm going to do the brachial radialis, and so you're finding the styloid process of the radius, and then going to go about 2 or 3 inches behind that. I'm going to check that real quick. Up and moved a bit, so that's good. So if you could sit as far back in your seat as possible, so I can get your knees kind of fluid as best as you can, and find right underneath that patellar tendon, so we can check the patellar reflex. Up. That one's a good one. And then we're going to move back onto the Achilles. So the Achilles is going to be right here. You're going to have the person's foot relaxed, and then, alright. And then finally, last but not least, I'm going to sit and check your plantar reflex. So you're going to pull it up, and that should make the toes curl, and that would be a normal finding. You would not want in a baby, that's a normal finding for an adult. A baby, their feet might, toes might curl backwards actually. So that is our entire head to toe assessment.
Great, thank you.
You good?